Sheikh Afsana gave birth to her daughter 2 months before her due date. The first few days of her daughter's life were spent in the neonatal intensive care unit. Afsana was ill and unable to breastfeed. Afsana's baby survived on another mother's milk, provided by a human milk bank. And now, Afsana is motivated to donate her excess milk.
इसकी माँ ऑपरेशन में जिसका सीजर वगैरह वो नहीं आ सकते अपनी बेबी के पास, तो हम वो दूध उसको डोनेट करते हैं और वो दूध भी जांच पहले होती है और फिर उसके बाद बच्चे को दिया जाता है। अगर आपको होता है दूध तो आप हेल्प कर सकते हैं दूसरे को।
While newborn deaths have reduced to half in the last 25 years, the progress has been slow when compared to infant and under 5 child mortality rates.
We have estimated around 0.8 million neonates dying every year. And if you look at the overall under 5 mortality, roughly we say around 1.2 million under 5 children die every year.
Evidence suggests that early exclusive breastfeeding has the potential to prevent 13% of under 5 deaths globally each year.
Mother's milk is not only a complete nutrition, but it also protects the baby against all kinds of infections, be it respiratory infections, diarrheas, and also protects against malnutrition.
Human milk is actually an excellent drug. It has been able to save premature and small for date babies with a lot of complications, especially one of them being necrotizing enterocolitis, leading causes of death in sepsis in many of the preterm babies.
Unfortunately, not every newborn is able to benefit from his or her mother's milk. Many vulnerable babies, like those born preterm, low birth weight, sick, malnourished, and left without milk, including those whose mothers are ill, not present, or have died. Human milk is especially critical for the estimated 27% of all babies born in low and middle-income countries. India is home to a large share of such babies. The solution: human milk banks. For vulnerable babies without access to their own mother's milk, the World Health Organization and other health leaders recommend donor human milk, made available through human milk banks as the next best feeding option. Human milk banks collect, pasteurize, test, and store safe donor milk and provide it to infants in need. The milk is collected from healthy donors whose blood is tested for HIV, hepatitis B, and VDRL. The milk is poured into sterilized bottles. This milk is then pasteurized to kill all bacteria and viruses and is immediately cooled down. A sample of pasteurized milk is sent to the lab for test. Once the lab clears it, the milk is stored at -20 degrees centigrade. This milk is then given to the babies on doctor's prescription. Saving babies with the use of another mother's milk is a century-old practice. Today, there are more than 550 milk banks in 37 countries. India launched its first milk bank in Sion Hospital, Mumbai in 1989. Even today, India does not have enough milk banks to meet its need of donor human milk.
25 years ago, we had about 6,000 to 8,000 deliveries in Sion Hospital. And we were really, losing a lot of babies. One of the reasons were they were getting diarrheas and sepsis. We looked at it and we found that, we were using formula milk. Then I saw a milk bank in Oxford, then in Birmingham. Then I said, my God, this is something we can do in India.
In India, strategies for effective country-specific implementation, regulation, and quality of human milk banks have been slow to develop, limiting the expansion of networks and services. National momentum to scale up human milk banks is now growing. PATH is working with the government, technical and policy leaders to scale up human milk banking systems as a part of the Mother Baby Friendly Initiative Plus, an integrated system which aims at strengthening human milk banks as a part of a lactation support center and provide a location for donation and processing of donor human milk to ensure safety, support mothers in breastfeeding, encourage kangaroo mother care.
I think it's a great idea which Path is promoting, and this is a very positive step in that direction, and that will really help in taking this human milk banking concept as an integral intervention of newborn health. I am considering human milk banking as one of the intervention to promote early initiation of breastfeeding, particularly in a situation in a country like us. It can really help in taking the agenda of breastfeeding forward.
It is estimated that 30 to 50% of babies in neonatal intensive care units and 10 to 15% of term babies are in need of donor human milk. Increasing access to human milk through human milk banks has the potential to reach 5 million babies in India annually. When combined with strengthened breastfeeding practices, this impact could increase tenfold.
मेरे को यहाँ ब्लेसिंग बहुत मिल रही है। मैं अगर किसी के बच्चे को दूध पिला देती हूँ, किसी की दादी नानी मेरे को इतने अच्छे से आशीर्वाद देते हुए जाती है और वो मुझे बहुत अच्छा लगता है।
There's still a long way to go. All stakeholders should come together to unlock the potential of breastfeeding and human milk and save the lives of our children.